Like to have a few drinks from time to time? Sometimes a few drinks becomes more than a few, and the following morning, you have a serious problem. What should we do about it? Acute alcohol withdrawal, sometimes known as a hangover, is not an uncommon problem. The question is, what should we do about it? Well, if you have more than a couple of drinks, particularly if you're mixing different types of alcohol while you're drinking, beer, white liquor, brown liquor, mixed drinks, all at the same time, you're very likely the next morning to not feel well. You're not going to feel well because what you're experiencing is what we call acute alcohol withdrawal. You get abdominal pain, you get nausea, you can have diarrhea, you can have a headache, you feel very lethargic and tired, some of which is a result of the dehydration that comes with excess alcohol use. So what's one of the main things that you need to do? Hey, don't forget, if you like the content that we're rolling out, hit that like button. It helps us with our algorithm on YouTube. Make sure you subscribe to the channel and hit the bell notification button so that you can be notified as soon as we roll out new content. Please send us some comments, questions. It'll help us in developing our content that we roll out, and then we'll be sure to hit the problems and the concerns and or the topics that are most interesting to you. God bless you. Work on rehydrating yourself. You may want to take something for the nausea. Some people will take some over-the-counter preparations in the form of antiemetic drugs like meclizine or Emitrol to help with the acute nausea. Then you need to make sure you're drinking some water and isotonic fluids in the form of like Gatorade, Powerade, those kind of things to replete the amount of fluid that you lost. We mentioned it in a previous video when we talked about dehydration, but alcohol is a diuretic. You lose a lot of fluid when you're drinking alcoholic beverages, and some people make the mistake of thinking that when they're losing that fluid, they feel more thirsty, drink more alcohol is the answer. Well, that is what perpetuates the problem of the withdrawal early the next morning, known as a hangover. So rehydrate, that's number one. Number two, if you're a chronic alcohol user who drinks heavily and you start having withdrawal symptoms, one of the things that you don't want to do is try to abruptly stop drinking, because you can go into severe withdrawal. Severe withdrawal, which can progress to a syndrome called delirium tremens, where you can become hallucinatory, start seeing things, hearing things, and you can go into actual vascular collapse and die. Alcohol withdrawal is one of the few drugs that in acute withdrawal can actually kill you. Alcohol and benzodiazepines. So if you're a chronic alcohol user and you wake up after another bender and you start having early alcohol withdrawal symptoms like a hangover, you may want to actually take a little sip of alcohol to prevent that from progressing to a more serious form of withdrawal. If you're interested in stopping drinking, and that's what you've got your mind made up to do, you may want to do it under the auspices or under the guidance of a healthcare provider so they can wean you off appropriately, not necessarily with alcohol, but with other medications that will prevent you from going into abrupt withdrawal that can cause possible lethal consequences. So what are the things that you don't want to do? Well, there are a lot of wives' tales out there about things you should drink or things you should take in a hangover situation. I've heard of a concoction of molasses with a cayenne pepper and Tabasco sauce in it. Not a great idea. If you've been drinking the night before, your stomach's probably already irritated from the alcohol use. You drink something real spicy like that, it's really just going to upset your stomach even more and perpetuate some of the symptoms, because it's going to make you throw up and you're going to lose more fluid that you're trying to replace to treat the symptoms of the withdrawal. So don't do that. So those are a couple of suggestions of things you should and should not do if you start having problems with withdrawal. If you notice that this is a problem that's occurring to you more than just every now and again, you may want to really take a look at your alcohol consumption in general. If you're starting to have problems with withdrawal, particularly if you start noticing that after you've been out drinking, you are having what we call blackouts, where you're not really sure what happened, where you were, what you were doing that night before while you're drinking, you really do want to take a look at the amount of alcohol that you're drinking and seek some professional help, as this may have been more than just a social issue for you at this point and becoming a habit. Take my advice. You want to get off of that train before that train gets too far out of the station. It's a lot easier to prevent it than it is to reverse it once it becomes a real problem. God bless you.